Hi, Dr. Gerling here. I just wanted to take a minute to talk about chronic pain in the context of orthopedic and spinal problems. We all know that there is some psychological component to pain, and there's famous writings about the psychology of back pain. Everybody's heard of John Sarno, who said that all back pain is in your head. I think it's really important for us to consider for a moment the impact of psychology on our perception of pain and certainly how we treat pain. We know that back pain is severe. Obviously, you sense it in your brain. So the question is, how do we modify it? When do we consider it psychological versus being something that is purely organic or related to some underlying problem in your spine? Certainly, see a professional, get diagnostic testing done. There's experts that will diagnose problems that are underlying, but over 50 million people in America have chronic back pain that's not currently being treated because they haven't found some underlying problem. So how should we manage this? That's a big question. It's something that I'm going to start addressing in a lot of my videos. For now, I think that it's very important after you've had your diagnostic testing that you're always considering how your mind perceives pain. Obviously, exercise is really important for that. We've been talking about some of the studies that have come out that help people with chronic pain and how important it is that doing exercise every day will impact your pain. Walking more than an hour and a half was a part of the trial that was published in JAMA. Certainly, an hour and a half a day is a lot, but if you're in chronic pain, that might be the answer for you. In addition to that, I think that having some type of impact on your psyche through other means is important. Sleep is going to be very important. Obviously, that impacts your ability to manage the pain, and also it actually rests your brain and allows it to adjust and modify the way it processes pain. Meditation is one thing that people use. Meditation is very important. If you have difficulty relaxing, it will help you sleep as well. It's important in many, many ways, and I recommend it. There are other issues that you can consider, but certainly using medications prescribed by a doctor would be helpful. There are naturopathic type medications that can be prescribed as well, things like teas, herbs, all those types of things that are actually thought to relax the nervous system. Acupuncture can be helpful for that. And then at the end of the day, I think having a good therapist that helps you talk through your issues. There are courses that are given that help one with biofeedback and other types of psychological treatments that could be very helpful. So we'll continue this conversation and dialogue trying to help people with their chronic pain.